Now, one of the other ones that can be pretty challenging are these inflammatory myopathies. So this is going to be dermatomyositis, polymyositis. Myositis is part of a rheumatic disease overlap. Anti-synthetase, which is what we'll talk about here in a moment. Inclusion body myositis. So these are going to be, again, your inflammatory myopathies. Think about elevated CK. Again, it's all part of your differential when you're thinking of connective tissue disease associated with ILD. But the one that I really want you to think about is something called anti-synthetase, which is really the interstitial lung disease is more common here than in some of the other ones. So this is where a patient would have, usually they have like this non-erosive arthritis. So I definitely seen it where it's like multiple skull and joints. Oftentimes the myositis, that's a piece of it. Raynaud's, they can have this thing called mechanics has, where basically, it really does. It looks like somebody that has really hard working hands, like dry skin, swollen, cracking, like that's kind of what it looks like. They can have fevers. The antibodies that are associated with this are going to be your Jo-1 antibodies, also SSA antibodies that are associated with anti-synthetase. So again, you see a new ILD, you ask the person, especially if it's a guy, like, do you, have you noticed any weakness? Then they may say yes. You look at their hands and you're like, wow, are you a mechanic? Are you a hardworking person? No, I work in an office or whatever. Think about this, because this is definitely another one of those sets. Now, again, I do not at all expect you to memorize this, but here's where it gets interesting. The antibody, so if you can order a myositis panel, that can be really helpful to you. It's really helpful to me too, because different antibodies are associated with different manifestations that go along with these, okay? So I'll give you an example. MDA5. Do we all know MDA5? Yeah, you all know it really well because these people have a very progressive, often, the outcome is not typically good, interstitial lung disease that's very rapid and progressive. And so they have often a poor prognosis. So that's part of a myositis panel. So it will pick that up. I have one sitting in my inbox right now that I'm addressing with a new patient that I saw. So the different antibodies have different things, right? Some of them, they would have a better prognosis. The other thing that I would say too, and this is just kind of another table, just because I thought it was interesting that it showed, different things. Again, this is just different ones are associated with malignancies, etc. So just use that as a tool. And then you can look up, like you have an ILD patient, you're suspicious that they may have an underlying inflammatory myositis. You order the myositis panel. The antibodies will help guide you in terms of what needs to happen next and how urgent things are. Again, treatment's the same. We use JAK inhibitors for these as well. The JAKs were great for arthritis. Again, we love rituximab in these patients. And then I would also just say to you that patients with particularly dermatomyositis, and so they have a rash, they can have something called a Schull sign, they're at much higher risk for cancer. So do I expect that my pulmonary colleagues are going to be the ones to do the full malignancy workup? No, but these people need to have a cancer workup. So when I see a patient that's new dermatomyositis, I'm doing a CT of, if they haven't, again, maybe you already done the CT, but I'm doing a CT of their chest, abdomen, pelvis. I'm doing a mammogram. I'm making sure they're current with a colonoscopy. I am going to do a pelvic ultrasound. I'm going to kind of do a full cancer workup on those patients, because here's the thing, and we do that really for 3 years. And I had one new dermatomyositis patient that, like, the very first time I walked in the room, her head was like slumped down, and I'm like, oh gosh, this is the inch report, she was late, and I'm like, oh my God, what's going on? And I got her into such great, like, we did so well. She was on IVIG, she was on, she just did beautifully. And then she developed breast cancer. And so, so she's currently being treated for breast cancer. So I say all of that just to say that, like, the cancer can happen later. It's not often at the beginning. So we just keep on top of that.